Have you ever wondered how quantitative research is conducted in public health? Today, we're going to delve into the fascinating world of data collection, variables, and statistical tests, all integral parts of public health research. The process of collecting quantitative data in public health is systematic and follows a series of well-defined steps. First, we start with identifying the research question or hypothesis. This question forms the backbone of the entire research process, guiding what data to collect, how to collect it, and how to analyze it. Next, we determine the study design. Will it be a cross-sectional study, a case control study, or perhaps a cohort study? The choice of design depends on the research question and the resources available. Following the selection of the study design, we then choose a sample population. The sample population is a subset of the larger population that the research question pertains to. It's crucial to ensure the sample is representative of the larger population, to ensure the findings are applicable beyond the sample. Now the data collection begins. The data collected is numerical or quantitative, which means it can be measured and quantified. Traditional techniques for collecting numerical data in public health include surveys, health records, and observational studies. This quantitative data can be categorized into different types of variables, including nominal, ordinal, dichotomous, and continuous. Nominal variables are those that fall into different categories but have no order or priority. An example would be types of diseases like influenza, malaria, or hypertension. Ordinal variables, on the other hand, are categories with a specific order. For instance, the stages of cancer, where stage 1 is followed by stage 2 and so on. Dichotomous variables are binary. They only have two possible outcomes. A common example is a person's status of having a disease. They either have it or they don't. Lastly, continuous variables are those that can take on any value in a range. Body temperature, for example, is a continuous variable as it can vary along a continuum. Another tool often used in public health research is the Likert scale. This scale is used in questionnaires and helps measure attitudes or feelings on a continuous scale from strongly agree to strongly disagree. Once data is collected, it's time for analysis using statistical tests. Parametric statistical tests are often used in quantitative research. These tests assume that the data has a specific distribution or set of characteristics. The type of parametric test used depends on the type of variables. For instance, a t-test is used when comparing the means of two groups, while an ANOVA is used when comparing the means of 3 or more groups. In summary, quantitative research in public health involves identifying a research question, deciding on a study design, selecting a sample population, collecting data, categorizing it into various types of variables, and finally, analyzing it using statistical tests. It's a meticulous process, but one that yields valuable insights into public health, helping us understand and intervene on health-related issues. Remember, the goal of quantitative research in public health is to take us from curiosity to discovery, and finally, to solutions that improve people's lives. So the next time you come across a public health study, you'll know the rigorous process it took to get there.